So next is the voice of business news in Los Angeles, Frank Mottek. Frank is a senior money advisor on CBS's KNX 1070 News Radio. I know we're driving less these days, but when you're driving in your car, turn into 1070 News Radio. Frank also hosts Mottek On Money on radio.com. So Frank will be joined by UCLA's Dr. Anne Rimoin. She is a professor of epidemiology at the UCLA Fielding School of Public Health and the Infectious Disease Division at the Geffen School of Medicine. Dr. Rimoin is an internationally recognized expert on Ebola, the human monkeypox, disease emergence in Central Africa, and now COVID-19. She's an expert contributor. You may have seen her on CNN, the 11th Hour Brian Williams, and other news shows. Her work has been featured in the New York Times, The Atlantic, Scientific American, Nature, National Geographic, as well as more than 70 research publications and articles. Her advice on how to keep employees safe in this crisis is sought after by many, many companies today. So welcome, Frank, and welcome, Dr. Anne Rimoin. Thank you both for joining us tonight.
Thomas, thank you very much for that very kind introduction. I have to say the commute was a lot better than it usually is getting to the campus. It was about 10 seconds going from one studio to the other here this evening. So that's one positive thing that we can celebrate thanks to technology. Good evening to the Innovate at UCLA family. It's an honor to be with you and a high privilege to speak to Dr. Anne Rimoin, who, as has been mentioned, has provided tremendous leadership during this pandemic, which has reached a critical point this week with big news again today. Dr. Rimoin, welcome and thank you very much for being part of this evening to discuss UCLA's role in the COVID response. And let me share some news that we just got here in the studio today, and that is that unfortunately California has become the second state behind Texas to eclipse 1 million known cases of COVID, while the U.S. has now surpassed 10 million infections. And sadly, the U.S. death toll now approximately 242,000. Dr. Rimoin, you've been following this since the very start, and we've reached a very critical point here. Give us your reaction to this latest news, first of all.
Well, Frank, thank you so much and thank you to Innovate. I'm really appreciative to be here, and it's always nice to talk to you, Frank. I always do enjoy our conversations. I will say, of course, today we had many things that we were thinking about talking about, but we have reached a grim milestone here in California, and we are now on track to escalate, and if we don't start doing what we need to do, more mask wearing, avoiding social contact with others, really limiting our social contacts with groups. In fact, we just heard just the other day, many of these cases, I believe the number was 10% of cases just here in LA County had reported being at a gathering of 10 people or more, those people who were COVID positive. So we really do know that these gatherings are sparking more cases, and we're going to continue to see this if we don't really all do our best to limit our contact with other people, and of course wear a mask, hand hygiene, and all the things that we've been discussing from the very beginning.
I believe it was just about 3 weeks ago that Dr. Gottlieb said that we're about 3 weeks behind Europe, which has imposed lockdowns, and now in New York and in Chicago, they've imposed some business restrictions in response to this latest spike. Are we heading in that direction here in California?
Well, what I can say is that we are seeing an escalation of cases. These cases will continue to rise. We know that COVID spreads exponentially. And so when we look to see what's happening in Europe, we can see we're not different. Our immunity, our status of immunity is not different. So we can anticipate seeing cases really rise. What I can say is that in this state, we're not going to be opening up more. We're likely to become more restrictive. Whether or not we have a lockdown is yet to be seen. And I don't think that that's really actually on the table at this point. What I think everybody hopes for is that people really do the right thing and that we limit the spread as much as we possibly can by all doing our part.
We did get the good news early in the week from Pfizer and the German firm BioNTech. Give us your reaction to the work on the vaccine front that trial indicated that it was 90% effective.
Well, I think that there's good reason to be optimistic. I am cautiously optimistic, as the rest of us. There are many things that are really great to think about when we think about this news. I will put the caveats in place. This is science by press release right now. We don't have the data, and I'm waiting to see the data. We're all looking to see the data. But here's some good news. We now understand that the way that the spike protein that this vaccine has targeted seems to be the right target. That's great news. We really were wondering if that was going to be the case, and this is what we're seeing. Other really great news here is that if this vaccine proves to be effective at preventing COVID-19, it's really good news for some of the other vaccines that are coming down the pike, like the Moderna vaccine, for example, or the AstraZeneca vaccine, as another example. These mRNA or messenger RNA vaccines are new technology. We've never seen them used before. They've never been licensed for use before. So this is really good news. Now, on the other side of this, though, we still have a lot of questions about this vaccine. We really, in particular, we want to know, does this prevent serious disease, severe disease? Does it prevent death? Does this protect everyone? We're including pregnant women, children, vulnerable populations. We don't have answers to this at this point. We also are very interested to understand durability of immune response. And so that means, how long is this vaccine going to be efficacious in preventing disease? Is it a month? Is it 2 months? Is it 3 months? Is it 6 months? Is it a year? Is it a lifetime? We don't have answers right now. So right now we have scant data that looks to be very promising, and we could all use good news right now. And this is indeed good news, but we're waiting for more.
Let me ask the question that Thomas raised. When are we going to get out of this new abnormal and back to a more normal life?
Well, isn't that the zillion-dollar question here? This is a really big question, and there are many factors that will dictate this. First of all, of course, the vaccine or vaccines that we'll see coming down the pike here will help us get to a new normal. But the vaccine in and of itself isn't going to be a magic wand that we're going to wave. And there's still a lot to be done here before we get there. So masks, social distancing, hand hygiene, all of these things are critical. And right now, by the way, they're the only things we have available to us to be able to reduce the spread of this virus. We're seeing cases escalate across the United States. It is an explosion of cases. So we all need to be doing our part. When will we get back to normal? That's anybody's guess. If we follow the track of what we're seeing with this vaccine, the potential pathway for these vaccines, we could see vaccines first being available to vulnerable populations, healthcare workers at the beginning of next year. Maybe by the late spring, we could start seeing these vaccines being available to the general public. And then maybe by the fall, we'll have enough of the population vaccinated that we might start feeling a little bit better about where we are. But I think that masks and social distancing are going to be with us for a long time. But I do think a year from now, maybe where we are now, we're going to be feeling a lot more normal than we were in terms of getting back to normal. But I think that this has served as a warning to people. We always need to be vigilant. We always need to be monitoring new viruses. This is something that we've learned. It's better to prevent pandemics before they start, not once we have them. I always say, my late father-in-law used to say, it's much easier to stay out of trouble than it is to get out of trouble.
Dr. Rimoin, you have been called, your expertise has been called upon for business in academia and so forth. Tell us about UCLA's role in this pandemic and the work that you're doing there.
UCLA has been a major force in COVID-19 response and research since the beginning of this pandemic. So I am the principal investigator, along with Grace Aldrovandi, who's in the School of Medicine, for the UCLA first responder and healthcare worker study, where we've been testing healthcare workers here at UCLA, Reagan, and at Santa Monica hospitals, and also working with LA County Fire Department to be able to understand asymptomatic infection and immunity in these populations, and really also understand occupational exposures. The other major part of this study is looking at vaccine hesitancy, and we're just about to publish some of our data on vaccine hesitancy in these populations, which I think is going to be something very important driving policy going forward. In addition to this study, we're also doing a study looking at animal welfare and veterinarians and animal welfare workers, and trying to understand exposures, occupational exposures, risk factors, and also exposures to other coronaviruses and what that may look like in those populations. UCLA has been, the UCLA DRC research program in the Democratic Republic of the Congo has been doing similar studies in healthcare workers. That's the program that I've been running for the last 20 years. So we've been monitoring healthcare workers and other high risk populations in the Congo, also looking at these same things and being able to compare what we see here in the United States to what we see overseas. So we're doing a lot here trying to understand COVID, really trying to drill down and understand asymptomatic infection and immunity, and do our best to have cohorts available and ready that we can learn a great deal about and help figure out how to have the best policies going forward.
And Dr. Rimoin, we're honoring giants in the world of technology here this evening. Tell us from your perspective, how has technology positively impacted the response to the coronavirus crisis?
Well, there's so many ways that technology has been a major driver of response. I mean, one of the things that I had a very nice conversation just the other day with Thomas Phelps, and we were discussing the importance of IT just in general being able to support our lives and to make us be able to and allow us to be able to even have this meeting tonight. Zoom, for example, Microsoft Teams, Google Hangouts, all of these things have made our lives tenable in the context of a pandemic. We would not have schools open as they are right now and children in class, having class right now if we did not have this available to us. So that's one way that I think people don't give enough credit to IT in that manner. That is how businesses have been able to stay afloat and keep going, and we keep our students educated. I would also say there's so many innovations in technology that have been very, very interesting. I've done a lot of work with the entertainment industry. I've been advising several production studios, a variety of different groups, as well as businesses and schools, a whole host of people. And a lot of the social distancing technology has been very interesting and very helpful, really facilitating contact tracing in the workplace, things that we've never seen before. So there are things like, for example, alert trace or proxy bands, things where you wear something that looks like a Fitbit on your arm, and it buzzes when you're within 6 feet of somebody else, but it also tracks your movement so that at the end of the day, you can really see who has been close to whom and how. And with the CDC change in guidelines, where now we know that small interactions do matter, and we're now looking at, as opposed to a close contact being 15 minutes, somebody being close to somebody else for 15 minutes within 6 feet, now it's cumulatively 15 minutes over the entire day. These alert trace and proxy bands and other technology like this have made an enormous difference for businesses and productions globally, in fact. They'll be used in schools as well. It will facilitate contact tracing in a way that we've never seen before, and also does not have the same issues with privacy that putting an app on your phone would, because you get it at the beginning of the day, when you enter a school, when you enter a business, when you get on a set, and then you hand it back at the end of the day. So it's not something that's recording any of your personal data. It's just tracking where you are on site. And I think that is so critical. But we've also seen things. I'm wearing one of these. I can't even remember the name right now, but one of these these rings that can actually tell you about your heart rate, your respirations. There's so many different things that there's so much technology. Even your iPhone can tell you about your respiration and your heart rate now. In fact, there's an app on an iPhone that tells you how long you're washing your hands and if you've done it for 20 seconds or not. So you don't have to sing row, row, row your boat or happy birthday over and over again. I think that all of these innovations in technology are really terrific. And it really shows us where we are now and how different this pandemic would have been without the technology that's available.
We celebrate technology and all of the great honorees being recognized tonight. Unfortunately, our time is up here. The time has just zoomed by as the whole year has zoomed by, Dr. Rimoin. Thank you very, very much for sharing your expertise with us here. The program continues. Let me turn it over now to Thomas Phelps.